In the United States, 60,000 new cases of bladder cancer are diagnosed every year, and smoking is the #1 risk factor. The bladder is an expandable, hollow organ in the pelvis that stores urine before it leaves the body during urination. It's not necessary to have a bladder to live, according to the American Urological Association, but the body must be able to expel urine. A cystectomy is the surgical removal of the bladder. It's used to treat bladder cancer that has spread into the bladder wall or to treat cancer that has come back following initial treatment. Following surgery to remove the bladder, your surgeon will create a new channel for urine to pass from your body. For some, this means wearing a urostomy bag that is designed to stick onto your abdomen where it collects urine from your stomach. Patients undergoing bladder removal have another option, the neobladder. This operation creates a new bladder using a portion of the patient's intestines. To learn more, we went to Oregon Health and Science University Cancer Institute and spoke with the surgeon who leads the bladder cancer program, Dr. Sia Danishmand.
At OHSU, we've developed a fairly aggressive and comprehensive approach to the treatment of bladder cancer. A cystectomy provides the best survival outcome and the lowest recurrence rates for patients with muscle-invasive bladder cancer. The urostomy, which was developed in the mid-1950s, is a bag that is worn on the outside and holds the urine. However, it can hinder patients' lifestyles, for instance, if they're very active or go swimming.
A neobladder replaces the bladder by using part of the intestine. Dr. Danishmand takes a piece of the intestine, then cuts and stitches it to make an inflatable pouch that's joined to the neck of the urethra. It will store your urine and allow you to urinate through your urethra, much like you did before your surgery.
After removing the cancerous bladder, we're going to reconstruct a new bladder made from the intestines. Here we've isolated a 60 centimeter segment of intestine, and we're going to make a new bladder out of this so that we can hook it up to the urethra so the patient can urinate normally through the urethra. This is a cylindrical sort of tube, and we're going to need to make this into a spherical tube, much like the bladder, so we can connect it down to the urethra.
Thousands of lives have been saved by detecting cancer at its earliest, most treatable stage. At Oregon Health and Science University Cancer Institute, you're cared for by one of the most experienced, knowledgeable cancer care teams in the area. These experts meet regularly to plan out all aspects of your cancer care, taking into account your personal preferences and expectations. This team is dedicated to answering your questions, addressing your concerns, and maximizing your involvement in your care.